And a good Monday, Mark Daly at the assignment desk with a top story.
For almost 30 years, Mark Daly has been reading the news to Toronto area TV audiences. In 2004, Mark's doctor had news for him about prostate cancer, and it wasn't good.
Well, you're just totally in shock when you hear the word cancer in association with your name coming across a desk. I was surprised because I was only 50 years old. My father was diagnosed when he was 69. My other uncles were, well into their 60s or 70s. So, I was stunned at the age of 50 that I got this news.
A prostate-specific antigen, or PSA test, indicated his level was slightly above normal. That and Mark's family history convinced his doctor that a biopsy was needed. It showed early traces of prostate cancer. Thanks to research, he had several options for early treatment. Mark chose brachytherapy, the insertion of tiny radioactive capsules next to the cancer for precise radiation therapy.
That's the mark I know.
The biopsy was June 8th, the diagnosis was June 23rd, 3:07 p.m.
Mark is now both survivor and advocate. He went public with his story on TV. He continues to encourage other men to talk to their doctors about getting tested, and it makes a difference.
In fact, I had a guy come up to me at the cancer center there one day when I was in for one of my checkups, saying, "My name's Brian, I'm from Barrie, I'm 43 years old. I'm here because of you," and because I did my whole thing on TV, of course. And he says, "I found out I got here probably just in time." And that really sort of cemented it for me that I did the right thing going as public as I did.
Dr. Robert Bristow is an experimental radiotherapist and an expert in the genetics of prostate cancer. He works in the lab and sees patients. Prostate cancer is the third leading cause of death in Canadian men, so he knows that the first step to beat that statistic is early detection like Mark Daly's.
So the danger is that if it wasn't actually picked up early, that it could spread elsewhere and make it much more difficult to treat. But for the most part these days, we're actually picking up early cancers.
And thanks to research, doctors are now able to customize prostate cancer therapy.
It's about you. It's about individualizing treatment to you rather than treating you as 100 men that come through the door. If you are trying to decide between surgery or radiation therapy, maybe there's a genetic signature in your tumor that suggests that surgery is a better option rather than radiation therapy. We'd all like to know that up front so that we didn't put a patient through 8.5 weeks of precision radiotherapy, but in fact it's not going to be successful.
Dr. Bristow's genetic research, funded by the Canadian Cancer Society, is helping men to make those treatment choices.
So I would say to donors, this is really an era that we haven't had before. The ability to look at the novel biology and to actually have technologies, and instead of looking at one gene in a biopsy from a patient, we can look at 20,000 genes and rapidly get a genetic fingerprint.
For Dr. Bristow, it's like being a high-tech detective.
For every patient, I think they have their own secrets, and the secrets really lie within their normal tissues, but also their tumor tissues. So you do have to be a detective. You have to have the tools, you have to have the team, and you have to have the enthusiasm and determination to really find out what the answers are. So I think a detective hat is one that we wear every day.